The session, funded by the World Health Organization, also witnessed the launch of a technical working group and national action plan geared towards formulating research-based policies for the prevention of antimicrobial disease. The World Health Organization country representative, Dr. Desta Tirone, highlighted the disease as a global concern, stating the need for multi-sectoral efforts to develop a preventive strategy.
AMR resistance is one of the top global public health development threats. It's public health and development threats because of the dimension it actually affects development in different ways. It's estimated that bacterial AMR is directly responsible for 1.27 million global deaths in 2019 and contributed to another 4.95 or almost 5 million deaths also in the same year. That's a huge number just because of AMR. Imagine a person admitted in the hospital, and then you have infection, but all the antibiotics that you use are not really effective. So what do you give to this patient? You leave him for nature to decide. That's what is happening.
The Deputy Director of Health Services, Momodu T. Nyasi, described the global health challenge posed by antimicrobial resistance, citing its threat on both human and animal welfare.
This growing phenomenon has significantly threatened our ability to combat infectious diseases and pose significant threat to public health globally. AMR is a complex issue, and it has affected all countries, regardless of their level of development and resources. It has far-reaching consequences, impacting not only animal health, but also human health, food production, and environment.
The Deputy Permanent Secretary at the Ministry of Health, Babanding Sabali, underscored the importance in creating legal frameworks as a mechanism to end the misuse of antibiotics in health facilities, hailing the government's efforts in standardizing the use of antibiotics in the country.
We must put in place regulations that will ensure that prescribers prescribe in accordance with the standards. Government of the day has put in place certain measures and strategies that will ensure that AMR is controlled. One key thing is the development of the standard treatment guideline. The standard treatment guideline will ensure that drugs are optimally prescribed as when required.
In 2021, a situational analysis on antimicrobial resistance in the Gambia was conducted for the first time to benchmark information on antibiotic consumption in hospitals and local communities. The data has raised concerns about the growth of multi-drug resistant tuberculosis and resistance to some commonly prescribed antibiotic drugs in the country. Ebrima Bah, GRTS News.